I was first introduced to the VivAer procedure when I started in ear, nose, and throat. What I like about VivAer is that patients come in and a lot of them are worried that they have to go through a surgical procedure in the operating room and miss tons of work and recovery time, and we're able to offer them something in the office that takes less than half an hour with minimal recovery at home, and it changes their ability to breathe. I've set up this room countless times for other patients, and today is going to be a little bit different because I'm the patient. My name is JaNell. I'm a nurse practitioner. When I breathe in, the sides of my nose will collapse down, and therefore it cuts off my ability to take a good breath through my nose. So it was difficult, particularly when I was sleeping. I felt like I wasn't breathing well through my nose. If I was exercising or out and about, I would have a difficult time getting a deep breath through my nose because everything would close down on itself.
All right, JaNell, are you ready for your VivAer procedure?
Yes. It was done in less than 15 minutes. I was numbed up and a wand was used to apply energy to my nasal valve, which is why I was having the dynamic collapse. So the VivAer not only treated the dynamic collapse of my nostrils, but it also helped clear up my nasal obstruction.
All right, I think we're done on that side.
So I had the VivAer procedure about 3 months ago. Immediately after, I was numb and I couldn't feel anything, and I went home and everything was fine. As the numbing wore off, it was a little tender right around in here, a little bit of swelling, but I could still breathe better than before I had the procedure. The first night was fine. I slept really well. 1 week out, I was still just a little tender. I was still breathing very well. My nose did not collapse down. 2 weeks out, the tenderness was almost completely gone. And today, at 3 months out, I can breathe very well through my nose. I cannot make it collapse down. And I've noticed a great improvement in my sleep. I'm sleeping better at night because I'm able to breathe through my nose. I feel like when I'm talking to patients about the procedure, I can give them a firsthand knowledge of what to expect and what my recovery was, and also my improvements. I would recommend anybody that has nasal obstruction of any sort or dynamic collapse. This is an easy thing to start with, and it may be all you need. You may not need a more extensive surgery. I feel like the VivAer kind of exceeded my expectations. I thought that I would be able to breathe better, but I didn't realize that my nose would be this open. Kind of wish I would have done it sooner.